Nursing is a great profession and has been one of the best decisions that I have made, so I'm somewhat biased. While I do love nursing, it is not the career choice that I would recommend for everyone. It is very important that you are aware of the pros and cons and carefully decide if nursing is the right profession for you. How to become a nurse. Watch this video to learn more about how to become a licensed practical nurse, LPN, or registered nurse, RN. I will refer to a nurse as a registered nurse. You will need to complete 2 years associate degree in nursing or 4 years bachelor's degree in nursing programs to become a nurse. What are some financial considerations? The average debt for a nursing student is about $24,000 for an associate degree nurse and $30,000 for a bachelor's degree nurse. As a new nurse, you will make about $62,000 per year as a base salary. Your salary is widely dependent on which state you practice nursing, the type of nursing you practice, and the time of day you work. You have excellent potential to increase your salary after finishing certifications within your nursing specialty and, of course, higher education, which can lead to a very comfortable six-figure income. Nurses work flexible schedules with plenty opportunities to earn overtime pay, own a business, side hustle, or work another job for multiple streams of income. What are the possible reasons for not becoming a nurse? Here are reasons you should not consider a career in nursing. Going into nursing just for a comfortable salary or stable job is not good enough. While you have the potential to work your way up to make a lucrative salary, being a nurse can be taxing on your body physically and mind emotionally. There must be some other joy or purpose in wanting to become a nurse. If you hate school and hate learning, this could be a problem now and in the future. You do not need to be an excellent student or be a straight A student. But if you don't enjoy science or learning about the human body, then a career in nursing will be very challenging for you. A big part of being a nurse is being a lifelong learner. This means you must continually educate yourself even after finishing nursing school to stay up to date with your roles as a nurse. Learning activities are also a requirement for keeping your license as a nurse and for learning new nursing skills. Basically, continued learning and taking tests will continue throughout your nursing career. If you don't like working with people, being a nurse might not be for you. There are certain nurses who have limited contact with patients, such as school nurses, research nurse, or case management. However, you still need to regularly communicate with other people. For example, in case management, you'll be coordinating with insurance companies and doctors to develop patient care plans, so some people contact is still required. What are some good qualities of a nurse? Here are reasons you should consider a career in nursing. Are you a leader? Nurses are leaders of the patient care team. Nurses spend the most time with the patients and their families and must manage the entire plan of care, ensuring that all practitioners' orders have been reviewed and followed. Nurses sometimes find errors or inconsistencies in the plan of care and must communicate effectively with other members of the team as the patient's advocate to promote safety. Sometimes these conversations are challenging. Will you be comfortable with this? Does this sound interesting to you? I think it is quite fair to say that being a nurse is intellectually, physically, and emotionally challenging. Do you have an inquisitive mind? Are you comfortable with questioning why something is done the way it is being done? Are you caring, nurturing, and empathetic? Being a nurse will also require you to use critical thinking abilities to make decisions on priorities that promote the best patient outcomes. Are you a hard worker? This is one of the most important factors in being successful as a nurse. While you must be somewhat intelligent to be a nurse, it's much more important that you are a hard worker. Diligence, discipline, and persistence can overcome book smarts. The nursing profession requires critical thinking and for you to understand and apply complex concepts, but it's also a lot of memorizing of facts. This means that with enough hard work and persistence, students who are not that book smart can become very successful nurses. Take the time to reflect and find your why for nursing. So you might want to help people, but else will motivate you to be an effective nurse when you are exhausted and possibly feel burnout. If you enjoyed this video, subscribe to the channel so that together we can inspire, educate, and mentor a happier and healthier generation of nurses. Thanks for watching and see you in the next video.